Right. Chapter 16 medical overview. Um, so medical patients are going to be complicated at times. Medical patients have a lot of different complaints sometimes. Sometimes it's very straightforward. And then you're gonna have to make a lot of decisions. Is it really worth me running hot traffic to the hospital? Do we have the correct destination in mind? I know a lot of hospitals don't offer specialized services, so your renal patients, your GI patients, maybe pulmonary patients probably don't need to go to a particular hospital. Um, but then again, we learned a lot during the COVID and trying to get patients to where they can be treated appropriately. And sometimes that was even confusing because of the wait times and different things like that. A lot of places didn't have beds availability. We had a workforce shortage. And then, we were trying to get patients to a facility that could treat them. So there's a lot that goes into these patients. So infectious diseases, make sure you're aware of those and what the patient may have to keep yourself safe. So HIV, B, Hep B, antibiotic-resistant infections, MRSA, and different things like that. So these are not as time sensitive unless it is an acute situation. Your cardiac situations, of course, your bad respiratory patients. So a lot of times we can spend a little bit longer on scene with these patients and help them out and see what's going on. But your main thing is to get that chief complaint. A lot of times they have several different complaints, but we need to choose one for today and get that one evaluated. I know a lot of people that used to call the hospital ambulance service with chest pains and shortness of breath, and you would get them into the hospital and they'd have some abdominal complications. So a lot of people use those two chief complaints to get inside into the bag and then go from there. All right, make sure that seat is safe. Make sure you got the number of patients that are needing assistance. Um, so get your ABCDEs, your airway, breathing, circulation, deformities, or correction, disability, and exposures. Always check your airway and breathing. Make sure it's adequate. Make sure that you're auscultating it. Make sure that you got a correct reading on the pulse oximetry. If you need to use end-tidal CO2 waveform capnography with the nasal prongs, don't be afraid to do that too. If you do just have an unresponsive patient for some reason, make sure you get to the airway pretty quick and open it up. You can check circulation by radial pulses, also using your capillary refill time, and then making sure that we address any life threats that we need to pretty quick. You can look at skin color, skin temperature, possibly turgor for your dehydrated patients, where we pinch the skin up. And if that takes an elongated time to get back down to its normal place, we possibly do have some dehydration going on. All right, if they need rapid transport, that some of that population is unresponsive, airway breathing problems, obvious circulation problems. Um, so, all right, get your history with your sample. Don't forget about those, your signs and symptoms, allergy medications that they take, past medical history, their last oral intake. Don't forget that medical patients may, need surgery in the near future. So we need to know what in the last time they ate. And then the events that are leading up to today's, for them to be calling 911 today. All right, in your pain, you can ask about your OPQRST, ask for any allergies to medications that they need. Look around for the scene, see if you see any medications. 1cc syringes may be evidence of a lot of different things that this patient may need. Don't forget about your medical ID tags also if they're on a patient somewhere. Or if the patient's unresponsive, find somebody that can give you a little bit of history of possibly what's going on. Even if we've been through cell phones before, trying to find emergency contacts to kind of help guide us as to what may be occurring at this time. Right. Your secondary assessment, you want to identify any signs and symptoms not found in the primary one. Probably usually done en route to the hospital. So, and your unresponsive patients, probably going to be a full body exam. You may find something somewhere. You may have that narcotic patch on the very back of some, posterior side of the back. So you need to get it off, and that may be the reason why they may be unresponsive. Um, the unresponsive patients, you can do a limited or focused assessment, and always get your baseline vital signs. And then as you reassess, you're going to reassess everything. Is the chief complaint getting better? Maybe it's getting worse. We're going to reassess the vital signs, reassess all of our treatments that are being performed, and go from there. Make sure we alert the ED on what's going on with the patient and doing a correct and appropriate call in. Treatment for most medical patients not available in pre-hospital setting. So administration for medications is limited at the advanced AEMT level. So that's something that you're going to have to be familiar with your local formulary and what you can and can't use. But we can use AEDs on the patient who's pulseless and apneic. Like I said, same time maybe longer. There are some situations where you want to spend less time on a scene and kind of treat them like trauma patients. So your failures, cardiac or respiratory failures for some reason. Stroke patients are kind of, that gray area that we have enough time to possibly get this patient safely to a facility, or do we need to do it acutely? All right, MIs, and then possibly automental status patients. Ground transport staffed by EMTs and ALS providers, and air transport is staffed by the critical care nurses and paramedics. And make sure that we use these due diligently for each situation. So, during COVID, we fought this very hard, trying to get patients to the best appropriate facility. A lot of facilities want inversion just because of the huge uptake in patient populations and numbers coming into their emergency rooms and hospitals. So some tertiary hospitals do not provide specialized services, so we need to be familiar with that. We may have equipment that's being down during COVID too to work first at the hospitals or short at times. So, they may not have had an RRT, they may not have had an X-ray tech readily available. So, we had to make decisions based off of that too. Some patients will benefit from on-scene treatment. We were doing a lot more of this during COVID too. I've treated some respiratory patients on scene, and they were better and got better. They didn't want to go to the ER, so we made contact with medical control, and we were able to release them. All right, infectious diseases, growth or spread of harmful organisms within the body, and then communicable diseases spread from one person or species to another. So BSI, PPE on these. This doesn't mean that you don't treat them. It just means that we have to be more protective of ourselves. So make sure we're empathetic, making the patient comfortable, and always follow your agency's exposure control plan when cleaning and properly discarding of any disposable supplies. Our epidemics, new cases of disease in the human population substantially exceed the number expected based on recent experience, and then a pandemic is on a global scale. HIV and AIDS are still out there. A lot of people were telling back in the 90s and early 2000s, but they are not as much anymore. So, be mindful of that. Make sure that you're keeping yourself safe. There's some signs and symptoms of HIV and possibly AIDS. And then there's diagnosis and supportive care of AIDS. All right. And just make sure we properly take care of everything and take care of um, exposures, to our ambulance, to our stretcher, and different things like that. All right, flu still around, still going around, especially in the winter months. So make sure that we are wearing our face PPE, whether that be a surgical mask, N95, whatever needs, to help restrict that. All right, hepatitis. Sometimes the symptoms of it, the jaundice, yellow of skin from the bilirubin. All right, we pretty much are just supportive with hepatitis. Herpes, STD, syphilis is also a STD. All right, meningitis is initial fillers of the brain and spinal cord, and those are signs and symptoms of it. So please take standard precautions with them also, and we should have vaccines available. All right, TB. I'll make sure they're wearing the N95. If you're wearing an N95, make sure that the ambulance is free flowing and not on a closed air system. We should be having TB tests being done yearly just to make sure. All right, pertussis with the Wolfman call. MRSA, be careful with that. A lot of your bedbound patients in home care facilities possibly have MRSA. Always wash your hands behind these patients. All right, West Nile virus, Haitian virus, SARS, the bird flu. So, we dealt with COVID here recently with the airborne disease. There's the so Ebola is still out there, and it's still possible to make its way back here also. Zika virus. And then travel medicine, we were asking a lot of patients, they travel outside the country. Where did they travel? If they, we give up that information. And have they had any exposure right there or had any signs and symptoms, since then? Okay. All right. Medical patients will be a little bit more detailed with them here in the next couple of chapters, but just keep calm. You know, our rapport with these patients usually are the best thing that keeps them calm. Yes, they may feel like they are in a time of need in an acute phase. And then, a lot of times we've seen so many that we just think they should have possibly treated at home or something like that. So if the patient wants to go to the hospital, give them that right. If you have any questions, make sure you contact medical control. And you go from there to make sure that patient gets the most appropriate care.